Welcome back to the New South Wales Government's Business Connect webcast on business disruption. My name is Steve Waite, a Business Connect advisor and CEO of the Business Centre. Business Connect is a dedicated, personalised New South Wales Government program that provides trusted advice to help you start, run, adapt or grow your small business, and is delivered through an independent network of service providers across New South Wales. If you would like a business advisory session subsidised by the New South Wales Government under Business Connect program, call 1300 134 359 or email connect@treasury.nsw.gov.au. So to today's topic, public health orders in your small business. It's now time for us as business owners to get across the public health orders and review and implement changes again to our working business model and to ensure we operate our business in accordance with the public health orders as they've been set out along the New South Wales Government's roadmap for easing restrictions. We have with us on this webcast panel of speakers the smarts to interpret the information and share their expertise and provide practical insights. So on behalf of the Business Centre and Business Connect program, I'd like to introduce our expert panellists for this webcast. First of all, Christie Howson, owner of Osborn Law. Christie is a solicitor and director at Osborn Law, practising in the areas of employment, law and commercial litigation. Osborn Law is a commercial employment and property law firm situated in Newcastle CBD that provides a practical legal approach to clients with timely, sound, cost-effective and straightforward advice. By way of background, Christie has combined law and commerce degrees from the University of Newcastle with experience in corporate commercial law and insurance in multidisciplinary practices, primarily practising in the areas of employment law and commercial litigation. Antony Cruz is our second panel member, Regional Engagement Manager for Service New South Wales Business. Antony joined Service New South Wales in 2016 in the newly created Making Business Easier project team and was responsible for setting up the now successful Business Concierge service within Service New South Wales. Prior to joining Service New South Wales, Antony worked in investment banking and wealth management in Sydney. Thank you, Antony. Our next guest, Diane Loong, Managing Director of Skildare. Skildare is a leader at providing smart and simple HR strategies and advice with a qualified team on everything HR, from workplace compliance, policies and procedures to employment performance strategies. Skildare works with their clients to craft practical, cost-effective solutions that enable them to worry less and focus more on results. Now, the key topics we're going to cover with our panel in this webcast are interpreting public health orders as a business owner, your vaccinated and unvaccinated team members and customers, supporting your team with challenging and aggressive customers as people adapt to these stages of the roadmap, 70% to 80% to December 1. So they are the three key topics with us today. We want to, talking to the panellists, we want to untangle the technocratic and the bureaucratic and the regulatory framework, the legal framework that sits around this, that reopening involves. And our panel have been asked to be very clear and practical about ways we can comply with health orders, identifying possible carve-outs, legal carve-outs that protect our business in handling situations around reopening that might come about as we go forward to October 11th and through to December 1. But we've also asked them, as we all know, to consider their answers in that the reality is that even after we hit 80%, we are still going to be living with COVID for some time yet. And it's our shared bottom line as a group tonight that none of us want to have a transmission event associated with our business. So how do we avoid that and deal with that effectively if it does happen? And that's what we're here to talk to tonight. We know we've got lots of questions coming through already, which we've got noted. We will address those as we go. We hope that as we go through, many of those questions will be covered, but we will come back to them. So, to the first question, and I'm going to start with Christie, and our first question is as follows. My first question to the panel, what should small business owners and operators consider when planning or thinking about their risk when it comes to customers and employees when interpreting these public health orders around reopening? Christie, your thoughts?
Certainly. Well, look, I think all business owners at this point in time need to consider three main things for reopening on Monday. Number one is they need to have their COVID-19 safety plan in force, and obviously those details are on the New South Wales Government website. It's important that businesses educate both their employees and their customers on safe working behaviours and also on vaccination requirements. So really, it's time to start having those conversations. the other thing is, the third thing that I consider is also important is knowing the staff vaccination requirements under the public health order. So we are going to be looking a little bit at this new public health order and working out by industries what particular industries must have employees that are vaccinated before they come onto their workforce. So should we talk about some of those particular industries now? Is it worthwhile?
I think that would be useful because some of the inquiries we've had, as we said, you know, a cleaner versus a cafe versus a tradesperson. If we could try to address some of the nuances and that, and help people understand the differences depending on their business.
All right. Well, I'm happy to start going through. So the occupier of premises must take reasonable steps. So the government has indicated it must be reasonable steps to ensure that an unvaccinated adult is not on certain premises. So it's not mentioning whether someone has had a first vaccine or a second, it's fully vaccinated. So as of Monday, all businesses must take reasonable steps to ensure that an unvaccinated adult is not on the following premises. Now, they are higher risk premises, which are things like entertainment facilities, recreation facilities, hospitality venues, places of worship, and premises where significant events are going to be held. It also includes business premises that are the ones that we're all really eager to reopen, the hairdressers, the beauty spa, the nail salon, waxing salons, tanning salons, tattoo parlours, so those sort of places. Recreation facilities, public swimming pools, information and education facilities, and retail premises that are not critical retail premises. So it's fairly clear from the public health order that we cannot have unvaccinated employees in those particular working on those premises, and we can't have unvaccinated customers working on those premises.
Antony, Di, Christie, reading through all of the literature and all of the health orders, the phrasing "reasonable steps, reasonable care" is often what is said. You're our experts. What does that mean? How do people interpret that?
Does someone else want to have a go?
Oh, I can jump in, Steve. I think the most important thing for a business owner is to be aware of the latest of the changes that have been made, especially with the QR safety code checks or the safety requirements. Just keeping up to date with that, because you may have had a QR check-in or a QR safety plan in previously. Just make sure that that's been updated. That's very important because you shouldn't be caught short having an old version of the safety plan. And also to make sure that your the equipment that you use to read the QR code, especially with the new QR code cards that have been issued for people who don't have a smartphone, just to make sure those things are there.
Antony, you noted when we were talking earlier that the QR code has served us well since March last year for the last 20 months, and there's going to be improvements on that to include vaccination status. Is that right?
Absolutely, and it's kind of a thing now that everybody is used to, and it's you go to a shopping center, you see everyone's got their smartphones out using them, so it's become part and parcel of daily life now. And alongside the vaccination certification, which should be hopefully rolled out very soon, it's a no-brainer. It's just going to be part of that. So as you check in, that's an opportunity for the business owners to make sure that you're fully vaccinated, and if there are restrictions in place for unvaccinated or non-vaccinated people, there's an easy way to differentiate that.
Di, any
Just leading
thoughts?
on from what Christie was saying, thanks, Steve. I think to mitigate risk for employers as well as we're approaching coming out of lockdown, having good policies in place, because whilst Christie has outlined, not allowing unvaccinated people onto various premises, there's also a multitude of employers out there who don't fall into that. Offices, for example, and factories and workshops and manufacturing plants and etc. So there's an enormous group of employers out there who explicitly don't fall into this category. So I think it's really important for employers to understand what their rights and obligations are, but also having good policies in place. Whilst the public health order mightn't say, I legally have to ensure that an unvaccinated person doesn't come into my workplace. It's not to say that I might not want that in my organisational policy anyway, and that I might want to put that into a policy to say, I want to protect the health of my clients and of my staff and of people who are in my environment, so I'm going to write that into policy, that my staff need to be vaccinated, and visitors and clients who come onto my workplace. So they're decisions that employers are going to have to make.
So just because you fall outside of that category doesn't mean that you can't bring in a vaccination policy for your workplace. And Fair Work have given fairly good strategic advice, I think, on businesses that may want to bring in those policies, and there are a number of things to consider as to whether that would be a reasonable direction to issue to staff. And we're happy to talk a little bit further about some of those things, but I guess it's just making sure that businesses are aware, as Di said, it's not just... So at the moment, the public health order does apply to those particular areas that we've just outlined, but there is certainly scope for businesses in other areas to bring in policies if it is reasonable for their workforce.
And then leading on from that, Steve, leading on from that then is, our looking at whether people continue to work from home.
Yes.
So it's employers really needing to understand where their workers sit in terms of who's vaccinated and who's not, and what journey they're on in terms of that. So that then will give them a line of sight, if you like, on who they can bring back sooner rather than later, and in what capacity they can bring them back. Because there is caveats in the public health order that say we must allow people who are fully vaccinated to continue to work from home if it's reasonably practicable. Or we must require people who are not fully vaccinated to work from home if it's reasonably practicable.
That's right.
So that in itself opens up a lot of questions.
And then we were talking then from December 1, it's at the discretion of the employer from December 1 on.
That's right.
Which again could change between now and then, Steve, right?
Exactly. So look, one of the things we spoke about, and just staying on our first question, we've got quite a few questions coming through. We might jump onto some of those shortly.
Goodness, we do.
But one of the strategies that people can use is to manage this risk, and we note from people we speak to, they're already using some of their booking platforms already where people are making a declaration before they arrive at the place of service or the business itself. So is that a reasonable strategy where people are making a declaration to say, before I've arrived, I have my booking, like we did last year when we were booking restaurants? They can declare that they have got a double vaccine. Is that reasonable to do that under law?
Yes, I believe it is.
Yeah.
I mean, at the end of the day, I think what businesses really need to work out is, well, what is my policy? If we do or don't fall under the health order, under the public health order, and there's going to be different outcomes for different businesses. But not only do they need to understand where they sit, but they also obviously need to properly communicate that. And that communication to employees, that consultation with employees, the communication to customers is really going to mean less angst at the time when they're trying to enforce those laws.
Yes.
We're heading very quickly towards the topic of vaccination, a bit quicker than I thought, and that's okay. But we've got some questions up here. I think it might be worthwhile if we could, perhaps as a group, just look at one of these questions here about rights around asking for proof of vaccination, and there's advice that's out there at the moment. I'll be interested in the panel's thoughts. And also, unvaccinated employees, can they work, for example? So we might start diving into that area. So first of all, what are the rights of asking for proof of vaccination?
I think Antony was going
Antony?
to address the policy.
I think, especially now at the 70% level, it is a requirement that you need to make sure that people are vaccinated, because there are restrictions as to what they can and they can't do. And again, once that application or My Service app is ready, that's an easy way. It's a one process rather than currently where you need to scan in your QR code and also then show your wallet, which is the download of your vaccination certificate from the federal site. But once the My Service app is updated, and like I said, hopefully soon, that will be just in one process. And definitely that is something that businesses need to make sure that the our customers are vaccinated. Just to go back to your point, Steve, previously we said that you can have a declaration pre-prepared, but what businesses should not forget is that you should also check those customers when they come to the premises to make sure that
That's
is
right.
correct.
Yeah, good point. The other question, I guess, a technical question here, we might be able to tick this one off, is can people sit outside a venue if they're unvaccinated?
Well, I think they probably can. It talks about being on the premises.
On the premises.
So as long as, I mean, if the premises are...
Yep. Defined.
That's exactly right. It's whatever area it's in.
And another interesting question is about medical exemptions. How do we legitimise that? How do we cite that if we've got a small business owner? How does that? What's the current public order telling us, and what does law tell us about that in policy and procedure?
It's been pretty clear, I think, the medical exemption. So there is a form that has been that's available on the New South Wales Health website. I think it's been approved by the Chief Medical Officer, and the only exemption that is going to be able to be used is that particular form. So a simple, and Antony, correct me if I'm wrong, a simple letter from a doctor is not going to be sufficient. It must be, a medical exemption must be in that approved form.
Absolutely, and the customer should always have that at any time when they ask for it.
Yes.
Okay, we've got some other great questions there. I'm just concentrating on ones on vaccinations at the moment. Just a specific one here, cellar doors, what category do they fall under? Can they have an unvaccinated work?
Fell
so
under.
We'll look at that one if we haven't got it right away.
I think they were retail.
And do they fall under retail?
Hospitality, potentially.
I think it comes under hospitality.
Cellar door.
I think hospitality would...
Because if you look at the ANSIC code, that comes under the hospitality.
Yes.
That would make sense.
Cellar doors are types of retail premises. Cellar door premises are types of retail premises.
Yeah.
Okay. Another one here, which is recent information has come through, I know, to update about employees under 16. Do they need to be vaccinated? I think there's been some provision for exemption.
I don't think the public health order applies to under 16.
No, I think it's 16 and over.
So 16 and over.
Yes,
okay,
that's right.
Thank you. And there's another good question there in regard to industry about the difference between critical retail and essential services. Do we have any definitions or a better understanding of what a small business might fall under there, or what a business would fall under?
Well, it's really, it's set out in the public health order as to what those so we spoke earlier about the high risk premises.
Yep.
What was the other one?
Okay, the other one.
And critical retail.
Critical retail.
Yes, I don't think they're necessarily the same.
Yep.
So you're going to have to go to the public health order and look at each particular.
I was going to say, there is quite a big list of critical businesses on available. And I think the best option is, again, these things can change. So the best thing to do is refer to that page rather than assuming whether you are not. If you are in doubt, always check.
Yes.
And these things can change every day.
Yes.
Okay. The next area I'd like to expand on in this question around vaccinations is customer confidentiality, secure data, customer information. If we're citing vaccination status, what are the rules around that? What can and can't we do there? We might start with Antony and then come back to Di and Christie.
Steve, can you just repeat the question once more, please?
Not at all. Not a problem. What about customer confidentiality and secure data when we're gathering or citing customer information on vaccination status?
Yeah, so with the app, the information that is gathered is not even stored with Service New South Wales. It goes straight to New South Wales Health, and we download the information directly from the federal site. So we do not store anything. We do not share that information with anyone. New South Wales Health will monitor that for, I think, about 48 hours or 3 days or something. And if there's no outbreak or anything, that's then destroyed. So there is no sharing of information. It's not passed on. It's not written down anywhere. It is all digitally read.
Okay.
So the business itself never gets access to that information, does it, Antony?
Not recorded. Not at all.
Yeah.
Not at all.
Okay. What about keeping staff records on vaccination status in employment?
Now that's important.
Well, yes, it is important, and they are confidential records.
Yeah.
They are subject to the privacy principles relating to employees, and they need to be
kept securely.
Secure. That's exactly right.
Yeah.
So, I mean, I think businesses obviously should have privacy policies, and the policy should clearly set out how those employee details are kept. But it certainly must be secure and confidential.
Absolutely.
There's no doubt about that.
Antony?
Just to add to it, and employees also will have the My Service New South Wales app, and that's one way of checking rather than physically writing the names down. If they are vaccinated, then there's no need to manually maintain that and put that privacy thing out of mind. So there may be businesses or staff who will be not vaccinated or unvaccinated, those are the things you may have to manually keep. But in most cases, if they are vaccinated, it is going to be on the app and it's not going to be recorded anyway.
It's keeping more of a tally really on who is and who isn't, and
that's right,
what the status is.
Okay, we're getting another question that's come in, which is more in your area of expertise. Christie, is the refuser, the employee or the worker that refuses to be vaccinated?
Well, we're talking about those employees quite regularly at the moment, so it happens in all businesses, and it's not our job to take a moral stance in relation to these things. It's our job to really advise a business about its risk. So it very much depending on whether the business falls under the public health order or not, whether the business wants to bring in a mandatory vaccination policy, whether it's consulted with their employees and the employees want to do that. And then we're going to be looking at the particular employee, their position, whether it's a position where you're dealing with customers or dealing with employees or sharing facilities. So there are just a range of things. Also LGA, so if somebody who refuses to be vaccinated that's in Broken Hill could be very different to someone who's in an area where there is transmission in the LGA. So it's really something that it's not really a one-size-fits-all sort of answer. But what I can say is that employers really need to have an idea about what their workforce wants, then an understanding about legally whether they can do that. And they need to be having conversations with their employers. I mean, they need to know, for example, if an employee hasn't been vaccinated because they're in their 20s and they want to perhaps get a Pfizer vaccine and they haven't been able to get one yet, as opposed to just not wanting a vaccine for any, for a particular reason that's not protected by law.
And I think the Fair Work Act as well has been quite explicit in they've set these tiers out as to what's reasonable for employers to request and for vaccines as well. And it might be that one part of your business who's customer facing or might be dealing with vulnerable people on a regular basis, for example, might be, it might be reasonable to certainly have these employees vaccinated versus somebody who works in an office alone and virtually doesn't see the light of day, or sees very few people. And so it's a balancing act, and it's being balanced in your approach and being reasonable in terms of what we should enforce or mandate or require for employees.
We are finding a lot of our clients are having issues where they perhaps have sales employees, and those sales employees are now not allowed on particular premises of clients if they're not vaccinated. So sometimes it's being really driven by the clients as well. So it really depends on, as you say, where the business is, where it's located, but also it's really looking at individual roles.
Agree.
Another interesting question in this space, if you're in a high risk industry and an employee, or an essential industry declared, and an employee refuses to be vaccinated, do you have, given you follow all due process and consultation, do you have the right to terminate or dismiss them because of the risk to the business and to your customers?
Well, it certainly has happened in the aged care and the nurses industry. So those ones that were subject to the public health orders, there was certainly terminations in those particular industries, and I foreshadow that will continue to be the case.
There is a caveat in for unvaccinated employees, though, if we would require them to work from home if it's reasonably practical. So if we can have employees that can do that and work from home, then there is a requirement on employers to
make those reasonable accommodations. That's right.
I would ask, though, and I think it's going to be a question that's front of mind, what if we have an employee who chooses not to be vaccinated and cannot reasonably work from home? What do we do then when we're in an environment where we really need them to be vaccinated? What's your take on that, Christie, if I can ask that question?
Oh, look, certainly. I think if you have consulted with your workforce and the workforce has agreed at large that they want to bring in a mandatory vaccination policy, if that particular employee refuses to do that and can't meet the timeframes, I would consider, a grace period where perhaps they have the option to take some unpaid leave or some paid leave in order to I guess give it some space and give it a little bit of time. But certainly, I'd be looking at a show cause process, because the bottom line is, if this person must be in the office to perform their job and by refusing to be vaccinated they cannot be in the office, then they're unable to fulfil the
Yeah.
inherent requirements of their position.
Yeah.
So, as you say, there's a process, and you would need to take proper advice before you did that.
Absolutely.
But I foresee that it will happen.
There's an interesting question here which kind of harks back to early days of COVID, when we had sort of, blue team, green team, A team, B team coming into office, about unvaccinated people coming on site after hours. Is that a carve-out? Is that possible, or would you think that would be possible or not possible? You have to set your policy.
I think we've got flexibility arrangements in place before COVID ever came, right? So I think, like everything else, flexibility. We will always be falling to these flexibility arrangements too, and I think people who are unvaccinated certainly can fall into that. That if it is reasonable for somebody to come in when everybody else has vacated for the day and come in and they can do their work there, if we can accommodate that, it works for them and it works for the business, then certainly that's something that can be considered for sure. I think
PPE and hygiene practices followed it. Yeah.
Well, and there would have to be
as part of the safety plan.
That would have to be part of the COVID safety plan.
Absolutely, yeah. And these, I think, what we need to accept as a nation, as a world, and as employers, is that the world is forever changed. And I think the way we knew it, certainly for the medium to long term, I think we're going to have to be a lot more flexible and accept that. There is different opinions out there. There's different requirements now that's been forced upon us, whether we like it or not.
And this is with us beyond December 1.
And who knows what? I mean, things can change even before. Even though we're talking about December 1, who knows when, as we're creeping to that, what it'll look like as well.
Antony, there's another specific question here about mask wearing and the phases through 70%, 80%, and then through to December 1. So, have you got some information to help us there?
Yeah, with the 70%, Steve, the requirement if you're indoors and you need to wear masks, outdoors, and of course with the having X number of people within certain areas, you don't have to, but anybody who is in the front of house and staff will have to wear their mask, and that's important, and that's one thing that will be monitoring as well.
Yep. Another question here, and we spoke about this industry earlier before we came on air, was about cleaning businesses and, for example, for NDS clients. What are the regulations? How do they apply the public health orders to cleaners and I guess people working with people in their homes?
Yes. My understanding is that they've still been allowed to do that with certain restrictions on people not being in a particular room. So cleaners are able to come into a residence and are able to go into a business, obviously working safely with masks, but minimum contact and if the cleaners are working in particular rooms, as a general practice, I think it's good to exit your house and exit your premises if the cleaners are there. I think that's a reasonable thing to do at the moment, just practically. I think that would be very sensible.
Okay. And if I can say, for NDIS cleaners, they'd be working for an employer, and really we would like to see that employers would have a safety plan in place for their employees who they're sending into domestic premises and the like, to ensure that they adopt safety practices when they're in there as well. That's really important.
But particularly if they're working with vulnerable people.
Exactly.
The plan would be, if possible, to remove them. Yes, from the area.
From the risk.
So,
Okay, I think we touched on this earlier, but beauty and massage therapists, do they have to be vaccinated and clients vaccinated?
As of Monday,
yes. Yes. They're part of the.
It is, that's right. And once you get to 80%, it changes. It says they do have to be, and they need to still maintain that limit of 1 person per 4 square meter, even if after 80% and more. So, because of the service, it's a bit more stricter there.
And I know it appears in the health order, but Antony, we've got another question here about where can people find out, the definition of their businesses?
Oh, you mean the ANSI code?
Yeah. Well, the definition of their businesses insofar as where do they fall as an essential business or a non-essential business?
Okay.
That's all on.
The New South Wales Health web page, or the website has got definitions of that. And again, if they need a bit more information to really understand if it's an industry that is not appearing there, and if they need clarification, my recommendation is please reach out to us and we can find that for you, rather than don't second guess.
Yes.
Let's make sure that you are in the right area.
Yes.
And another question is about people who've got staff that are working between LGAs and working in different areas. How does that operate safely in regards to regulations?
I suppose with the 70% and 80% your travel is okay now. I mean, unless it is below 70, for the regional travel is not available. So there is no requirement as to within the metro area or the Sydney metro area, for example, or the regional wise. If you're within LGIs and if it's not a hotspot, you can move around, provided you have the all your gear and you're vaccinated and. And you the most important thing is make sure that you do carry your vaccination certification with you.
Okay.
Yes. And Antony, you were saying before, we were talking before about regional people not allowed in Greater Sydney and Greater Sydney people not allowed in regional. That's still the case at 70%?
That is still 70%,
yes.
And I think once you get to 80, hopefully something that I'm looking forward to is by the in a week's time, be able to travel.
Yes.
Unless you have a certain hotspot where that area may be locked down, so then you may not be able to go in and come out, or then you need to self-isolate.
Right.
Yeah. Another question, sort of back to you two, is around can you change an employee's role due to them not being vaccinated and redirect them to alternative duties? Would that be a reasonable thing to do?
I think it is.
Absolutely.
Yes.
I think that one of the things businesses should also do is, like I said, and as Christie said, have a discussion with the employee if there's a reason why they don't want to be vaccinated. See if there's something else that they can do, which will, or stop one. Get them involved with others, or something that they can do before you go to the step of termination or resignation or whatever it may be.
So reasonable and practicable to be able to do that legally, to redirect their work.
Yeah.
Yes.
If a person cannot do the inherent requirement of their job, right, because they're not vaccinated, for example, and there is another alternative, then that's a better option, isn't it?
Of course it is.
Then otherwise it's either that you don't work, or potentially you cannot work for a period of time, or else you undertake this other type of work. So again, it becomes a conversation and a consultation and an agreed way moving forward.
Okay. Okay, we've got a few questions that we will get back to, but I want to also look at our third question that we were focusing on as a panel that we prepared for, and this is around what do businesses do to manage challenging and aggressive customers, the legalities around this for the customer and for our staff to help make sure we are doing the right thing. And there's some good advice out there around and learnt experiences over the last 20 months as well that we've understood about that there are some products and services that are in high demand. People are stressed. You're going to have perhaps people lining up, and so barriers and just human behaviour controls, these sorts of things. But amongst the panel, are there any thoughts about that you could share about what can we do about aggressive behaviours, or people acting poorly, or people threatening staff, managing that whole dynamic?
I think, again, it's about a proper communication. So if you're, as a business, you're going to take a particular stand, whether it be in relation to vaccination or not, or if you are or aren't part of the public health order, I think it's really important that you communicate with the public at large and with your clients, if you have people coming in for appointments. There really needs to be that communication from the start, so that you've made your intentions very clear. I think you also need to provide an opportunity and an avenue for any particular person who wants to come onto your premises who is unable to comply with that policy to seek an exemption from that policy, from complying with that policy. And there needs to be a specified way on how they can do that. What I would prefer is that those sort of applications for an exemption to the policy need to be made in writing and should be made to the owner of the business. And hopefully that means that our frontline employees are not going to have to deal with these sorts of issues at the door. You would say things like in your communication that the staff don't have the authority to make any exceptions to what our particular view is, or a particular stance. But if you do want to apply for an exemption, you can do it in writing, and you need to address these particular issues, and it will be made to the owner of the business or to the GM, and you will get a response within, you know, a certain time frame. So hopefully, you know, that's just going to take a little bit of pressure off those people at the front end that have to deal with this. Steve, we spoke earlier about signage, but unfortunately at the moment, Antony may be able to help us with that when the New South Wales Government is going to get some
the
signs up
we know has been
those subject
fantastic,
to
the downloadable signage that we've all
they've been
got.
great. Yes.
It's a very good question, and I think this has been asked by a lot of my councils as well, and which we have raised as an urgent requirement. Again, once that is available, we will be sharing that, and hopefully sooner get that out. And also the other thing, just to add to the previous discussion, is also the business owners should also take steps to I would say, educate, keep the employees aware of their rights as well, as to how can they, you know, push back a customer because it's their health as well that's at stake. So these are the things that, you know, business owners can keep their staff so they know they have the answer. They have a lot of them will be questioned, you know, the legislation or the policy or whatever. Just a little bit of an update on that. Keep them updated with changes. That might also help the staff as well.
What about some strategies?
I think the New South Wales website has got fantastic resources there for the safety plans for virtually every industry and business you can think about. So it's you know, just googling safety plan, COVID safety plans, it'll come straight up. So and part of that is just putting in what industry you're in, and it steps you through quite easily, and it prompts you about to think about and one of them to think about, you know, how you will build a safety plan for COVID in your business. And it's very specific because every business is different, every industry is different. But part of that safety plan, which I love, is around employee workers' well-being, right? And part of what you're saying, Antony, and I entirely agree, is educating and training and having you know, having discussions with your staff around aggressive customers, or you know, and how to deal and how to push back and how to escalate and all of that. And so, you know, we're not making up the rules. The government are a lot of the time, or we're just abiding and trying to do the right thing by it. But so
maybe have some pre-prepared scripts. Something, you know, so that the employees, you know, if this particular issue is raised.
Yes, carving out things that are likely to happen that are risky and address them.
And how to deal with them. And, and that's part of our safety plan to look after the well-being.
Well, I must say today I downloaded from New South Wales Government the reopening toolkit, which is very good. It answers for many of you very directly a lot of the questions that we've covered in the webcast about reasonable direction, about directing employees, about asking employees for proof of vaccination, refusing unvaccinated patrons. It's got everything set out for you in black and white, and it's a really good tool. Perhaps to make yourself familiar with, it's very easy to access, and as we move towards the 11th of October, I think I'd recommend every small business owner get this and have a read over, and then use professional support and help, and then talk to your team, talk to your staff, and communicate with your customers. Many businesses have already done that through social media. One of the questions you had here is the battering that many people are taking, of being, you know, naming and shaming for taking a position. But as we've had to do for the last 20 months, I think a business should state what its position is and why it's doing it, backed up by QR code, backed up by public health orders, and preempt something before it happens.
I think part of bringing in these particular strategies and policies is making sure that there's a reasonable basis to do so, and you need to communicate that. You know, I think part of us, especially the business owners who are not subject to the public health orders, I think that there does need to be some justification as to why you're bringing in those particular rules in order to get buy-in from your customers and from your employees.
Look, got a couple of new questions here, which will go to shopping centres, and this is an interesting one, again, with the way QR codes operate. But shopping centres, who checks the vaccination status what about food courts? You know, if you go to your local shopping centre, there's a QR code at the front door, the sliding door's open.
Yes.
You do your QR code, you go to the baker, you go to the, not the hairdresser, but you go to Coles,
Sure.
wherever you might go. How does that operate? Anthony, you might have a sense of that?
Yeah, one of the most important things is shopping centres. The shopping centre as such has got an obligation to have the QR code at the entrance. So that is done, and there will be people there checking that. And further, as you go into the, let's say the food court or something, most of the businesses have their own QR codes because these are locations within the businesses that people will go, and there are codes that they will also be checking them.
Yep. Okay.
I think it's up to each individual business
Take responsibility.
to do that.
Yeah.
That's right.
Because again, we said at the start, nobody wants a transmission event in their business.
No.
That's ultimately what you do not want to occur.
No.
So take that on board. Another question we have here is quite specific to creative industries, but how do rules work with off-site film shooting? Does the safe work plan travel with you to another location?
If you're employing people, you're responsible for your employees.
Yes.
You've then got to look at the premises. If you're in control of those premises, if you're occupying, I guess, it'd be no different to work health and safety requirements. That would be, so if you've got work health and safety obligations, then you're going to have obligations in relation to keeping them.
So they'd probably
COVID
need
safe.
to do some sort of risk assessment at that new site that they went to, carrying along with them all of the procedures and policies that you have, but address that risk on that site.
Certainly.
And if the shoot is different, it's like running a number of events. It might be carbon copies, but there might be nuances depending on what a new venue would look like, etc. So it is making sure, a lot of it might be transferable, but it is making sure that
each specific one's given its consideration.
That's correct.
Okay, we're getting a very specific question here now coming through about, can face shields be worn as opposed to face masks? I don't know what that. Any thoughts?
I don't think so. I think face masks are the way to go. Face shield is only a secondary kind of guard, but face mask is more important because it is carried through the air. So I'm 100% not sure, but I think best is to check the health page for that definite answer to that.
Okay. I think we're getting quite close to addressing these questions. One of the things we'd like to share with viewers is that we've very much considered that there could be some nuances and changes between now and next week, and we would like to share that we were likely to run a webcast 2.0 on the public health orders next week with our panel again, which we're delighted to share. And Antony has also said to us that should he come across any immediate updates, he'll send them to us, which we'll share through our networks. But please look out for those on Service New South Wales and New South Wales Government and health websites, because this is a very fluid situation that we're in. But before moving towards conclusion, is there anything else that the panel members would like to add that they haven't had a chance to address or to conclude? I might throw to you first, Antony.
Basically, I think, as you mentioned, Steve, I would recommend everyone to please check Service New South Wales page. And again, our page has got links to New South Wales Health and every other agency that does provide the support and help for, especially mental health as well. This is a big thing as well for businesses. So I would recommend, rather wasting time trying to find out the answers, come to Service New South Wales webpage. There are links to every support and agencies that's providing these kind of help and support for businesses at this stage. So that's my recommendation. And again, if you need some personal support, we have the business concierge service, and by either visiting Service New South Wales page, requesting a call back, or again through the business centre, we are happy to help as well.
Thank you. Di, anything that you didn't have a chance to address or that you would like to raise?
I think I can imagine a lot of industry, hospitality and retail specifically, that have been, forced to really shut their businesses by and large for the last 8 or 9 weeks and longer in Sydney and Greater Sydney area. They're very, very keen to reopen the doors, completely understand that. There's a lot of other businesses, though, that have maintained some sort of ability to continue for their staff to work from home. What I would just say is we've got October 11 on our doorstep, very, very close. But I would say there's, with the exception of some businesses who I know are desperate to reopen their doors because they haven't necessarily been working. But it's being, for those that have been working from home and have been ticking along, reasonably well, I'd say plan well before you reopen the doors and are bringing your large workforce back into the workforce. Make sure you've got your policies and your safety plans in place, and you understand what your obligations are under the public health order, and that we do it right and we can communicate well, and we've got records of who's vaccinated.
Things are bubbling along okay at the moment. You don't have to do a mad rush for the 11th of October.
That's correct.
You're not obliged to do that. You can wait a few more weeks. You can wait a few more months. Make sure that you're well organised as opposed to rushing.
Right. I think that's an important message. Not the whole world doesn't have to reopen on the 11th of October.
Questions still coming through, and I just want to tick off a few more. So, was the 1 dose to go back to work a mistake? Is it now doable?
Go back to work a mistake. Double. Is it now double?
Double. Yeah. Is it now double? I think, as we understand it, in regional areas that have not had access to the vaccine, 1 dose of the vaccine will suffice, because there's a provision to recognise that in regional areas that didn't have the level of access, that you can have an employee come back to work with 1 dose and with proof that they are getting the second dose.
Yes, that's right. They won't be able to work in those areas that we identified earlier, those higher risk areas. But certainly employer-specific policies, we do find that some employers are going to bring it in a graded way, so they're making their views well known at the moment that they do consider that their business is appropriate to have a mandatory vaccination policy, and they are slowly introducing it with particular dates. So that's something that I'm seeing quite a fair bit of. It's common.
It's a reasonable
Christie,
approach.
Chance for you to wrap up. Anything you wanted to add?
Look, I guess the only other thing I really wanted to add is, at the end of the day, it is your business. The responsibility is with you as the employer. Don't get too caught up with what everybody else is doing or what you think you should be doing. If there's a law, if there's a public health order that applies to your business, you must comply with it. And if you don't comply with it, there are significant fines for doing that. But if you're not subject to one of those areas in the public health order, you really need to have a good appreciation of your business, the employees in your business, and you can make those decisions. If you feel that you want to make a decision and your employees are pushing you to make a decision, you can do that. Okay, as long as you are not acting in a discriminatory manner, it is not a recognised class of discrimination whether someone is or isn't vaccinated. Okay, so we need to remember that at the end of the day, it is your business, and you need to do what's right by number one, wholly and solely, you need to do what's right by your business from a risk perspective, in making sure that the business is not going to be sued for action that you take, but also making sure that the number one aim is to keep our employees safe and happy at work. And that will involve flexibility, it will involve consultation, it will involve discussions, and it may involve some tough action that others might like, but it is okay. As long as you're doing it in the appropriate way and you're getting the advice to do it, there is scope to do these things.
One last question here, which I'm sure we could all probably relate to or understand. Someone said, a distribution centre where they've got 2 separate workspaces, a warehouse and an office. Do they need a COVID-safe plan for each one? Well, my 2 bobs would be, there may not be a forklift in the office, but there may be manual handling, or there may be customer interactions in the office, but also in trucks and loading and unloading. So you just need to address the risks within one plan. Would that be safe to say, or would you need 2 different plans?
I think, there are some
template plans.
There are some template plans, that would be very specific to office and then to a distribution centre, for example. And there is also to say that if you've got multiple premises, multiple sites across, that ideally you would have
a plan for each.
A plan for each, because there is little nuances. Ventilation could be different from the office to the distribution plant, for example. So it's probably, the
ability to socially distance may be different if you're working, if 2 people in a factory have to work closely on a machine versus in an office where people are in their own offices. So and I mean that the whole, I guess the whole thing, one of the main things we've been talking about today is really you need to be looking at not just every workplace but every worker in your workplace.
Okay.
Yeah.
And also, Steve, just to
Yes.
add to it, the safety plan is basically for a premises, so it is
Yes.
not for a business as such, you know.
Yes.
So if you have different areas, I think they need to have a look at it, because again, as you mentioned, the layouts can be different, the
Yes.
number of people that will be in that premises could be different, so
Yeah.
it is for a location.
Yeah.
The plan is.
Thank you.
Yeah.
Good clarification.
And
Thank
they're
you all.
great resources, those
Yeah,
safety
they are.
plans.
They
Yes.
are well set out and industry
Yes.
nuanced as well.
They are.
Yes.
They're really
Okay,
good.
I think it's time for us to wrap this up. So first, I would like to, of course, thank our guests, Antony de Cruz, Christie Osborn and Diane Loong. I'd also like to say, if you'd like to contact these folk directly, if you like what they've said, you want to get some more information, we're more than happy to pass on those details to our guests. We'd like to again recommend the Business Connect program, which is a dedicated program funded by the New South Wales Government and delivered through a network of independent service providers. Whether you want to start, grow your business or change your business, come and see us. If you want a business advisory session subsidised by the New South Wales Government under Business Connect, call 1300 134 359 or email connect@treasurynsw.gov.au. All you need to do to access Business Connect is complete a registration form. Businesses can typically access 8 hours of support in a financial year, including business advice and live webinars, workshops and events. There's no cost for the first 4 hours of business advice. Businesses affected by COVID can access services free of charge. We thank and acknowledge the support of the New South Wales Government Business Connect program in funding the development and production of this webcast. And I'd really like to thank everyone. I'm Steve Waite, your host, and good luck with your businesses reopening. See you next time. We'll run one of these again next week. Thank you all.